All right, let's dive in. We're going deep on a topic.
Yeah.
I know you're fascinated by the GI system. You've provided some serious nursing school level stuff here.
It's going to be quite the deep dive.
It is. We'll zero in on the liver, gallbladder, and pancreas, our goal,
It's a good one.
to equip you with uh, a rock-solid understanding of these organs, their quirks, their functions, and some surprisingly common health challenges that they can face.
They really are quite complex and interconnected, more than most people probably realize.
Yeah, they really are. So let's kick things off with the liver. I've always heard it called the body's multitasking marvel. What do you think?
I think that's a pretty accurate description. It's constantly juggling an incredible array of tasks. Filtering toxins, producing bile, storing essential nutrients, all vital functions.
And it even has a dual blood supply, which I find fascinating.
Great.
Why is that so important?
Well, you can think of it like this. It's all about efficiency. The liver receives about 75% of its blood from the portal vein, which carries nutrient-rich blood directly from the GI tract. This means the liver basically gets a first look at everything that you consume, allowing it to start processing nutrients, filtering toxins, and regulating metabolic processes even before the blood enters general circulation.
So it's like the body's central processing unit.
It really
It's
is.
just handling all these vital functions. It's amazing how it can handle so much.
And don't forget one of its most important roles, bile production. Bile is essential for fat digestion.
Yeah, so bile is made in the liver, right? But it's actually stored in the gallbladder
Exactly.
until it's needed. It's like a dedicated storage facility for bile.
It really is a very efficient system.
Yeah.
And to make sure that bile gets to where it needs to go, there's the biliary tract, the network of ducts that transport bile from the liver to the gallbladder and then to the small intestine.
Right.
And this intricate system ensures that fats are digested efficiently and waste products like bilirubin are eliminated from the body.
So that's what causes jaundice, right? That bilirubin,
That's right.
that waste product from red blood cell breakdown.
Exactly.
It's interesting how that signals that there's a liver issue.
It really does, because the liver is responsible for processing bilirubin. So if the liver's damaged and inflamed, that bilirubin can build up in the blood, leading to that yellowing of the skin and eyes.
Right. Okay, so we've got the liver and the biliary tract working together.
Yep.
Now, where does the pancreas fit into all of this?
The pancreas, an organ that is often overlooked. It plays a critical role in both digestion and hormonal regulation.
It's like the double agent.
Yes, that's a great way to put it.
It operates in both the exocrine and the endocrine systems.
Exactly. On the digestive side, the pancreas produces powerful enzymes, amylase, lipase, protease. These enzymes are released into the duodenum where they break down carbohydrates, fats, and proteins.
It's like the heavy artillery for digestion.
Exactly.
Yeah.
And then on the endocrine side, the pancreas houses these clusters of cells called the islets of Langerhans. And those cells produce hormones like insulin and glucagon.
The blood sugar regulators.
Exactly.
Insulin helps lower blood sugar and glucagon raises it.
Precisely. It's a delicate balancing act, and the pancreas is the key player in keeping those blood sugar levels stable.
Wow. It's amazing how these organs, work in concert to keep everything running smoothly.
It really is a very, very fine-tuned system.
It is. But as with any complex system, things can go wrong.
Absolutely.
And when it comes to the liver, one of the most common issues is hepatitis.
Unfortunately, that is true.
So hepatitis. Hepatitis, I know it basically means inflammation of the liver. But what exactly causes that inflammation?
So in about 90% of cases, it's actually caused by a viral infection.
Oh, wow.
And there are several different hepatitis viruses, A, B, C, D, and E, each with their own mode of transmission and potential for causing long-term damage.
Wow, it's amazing how these tiny little viruses can have such a profound impact on such a vital organ.
They really can. They infect the liver cells, triggering an immune response that, while trying to fight off the virus, actually can lead to inflammation and damage.
So that's where you start seeing the fatigue,
Yeah.
the nausea,
Exactly.
the jaundice, and the changes in urine and stool color.
That's right.
Those are some red flags to watch out for.
Absolutely.
Now, I know that not all hepatitis viruses are created equal.
That's right.
Some are more likely to cause chronic infections than others.
Exactly. So hepatitis A and E are usually what we call acute infections that the body can clear on its own.
Okay.
Think of them as like the common cold of hepatitis. They're unpleasant, but they generally resolve within a few weeks.
And once you've had Hep A, you're immune for life.
That's right, yes.
That's good. Good to know.
Yep.
But what about the other hepatitis viruses?
Well, hepatitis B and C are the ones that can become chronic infections,
Hmm.
leading to long-term liver damage. These viruses can linger in the body for years, even decades, causing ongoing inflammation and increasing the risk of cirrhosis and liver cancer.
In cirrhosis, that's where the healthy tissue is replaced by scar tissue, right?
Exactly.
So they're pretty serious threats to long-term liver health.
Absolutely.
And then, of course, there's hepatitis D. It's like a double whammy. It can only infect people who are already infected with hepatitis B.
That's right. It's a defective virus, making the situation even more complicated.
So I'm curious, are there specific liver enzyme patterns that distinguish these different types of hepatitis? Because I know that would be helpful in a clinical setting.
That's a great question, and the answer is yes. There are some subtle differences. For instance, with acute hepatitis A, you typically see a significant elevation in both AST and ALT,
Oh, okay.
while in chronic hepatitis B, you might see a more modest elevation in ALT with a higher AST to ALT ratio.
That's really helpful to know. So we've got these viral threats to the liver, but I'm also seeing a lot of information about um, non-alcoholic fatty liver disease or NAFLD. What exactly is that?
So NAFLD is a condition where fat accumulates in the liver, even in people who don't drink much alcohol. And in fact, it's now the most common liver disease in developed countries.
Wow, I had no idea it was that prevalent. I always thought a fatty liver was primarily associated with alcohol abuse.
That's a common misconception. While excessive alcohol consumption can certainly damage the liver, NAFLD is strongly linked to obesity, insulin resistance, and metabolic syndrome. Think poor diet, lack of exercise, those extra pounds that we sometimes carry.
So it's another example of how lifestyle factors can have a significant impact on our health.
It really is.
What happens if it goes untreated?
So there are two main types of NAFLD. Simple fatty liver, which is generally benign, and then there's non-alcoholic steatohepatitis, or
Right.
NASH. Think of NASH as like the battleground stage of fatty liver, where inflammation is actively harming your liver and can potentially lead to scarring, fibrosis, and even cirrhosis.
So even though it's not caused by alcohol, NAFLD can still lead to those same serious complications as alcoholic liver disease.
Unfortunately, that's true, and since it's so closely tied to lifestyle factors, prevention becomes even more crucial. Eating a healthy diet, exercising regularly, and managing weight can make a world of difference in protecting your liver.
This is all incredibly valuable information. It really highlights the importance of, understanding these conditions and making informed choices about our health.
Absolutely.
So speaking of informed choices, let's shift gears now and talk about alcohol-associated liver disease, another major player in liver health.
It really is.
Okay, so let's unpack this. I think we all know excessive drinking isn't good for the liver, but how exactly does alcohol cause damage?
Well, over time, excessive alcohol use overwhelms the liver's ability to process and detoxify it.
So it's not just about how much you drink in one sitting, it's more about the cumulative effect of alcohol on the liver.
Exactly. It starts with fatty liver, similar to what we see in NAFLD.
Okay.
But if alcohol use continues, it can progress to alcoholic hepatitis, where inflammation takes center stage. And in the most severe cases, it can lead to cirrhosis, the irreversible scarring of the liver we talked about earlier.
So even moderate alcohol consumption can contribute to that buildup of fat in the liver.
It can.
I always thought you had to be like a heavy drinker to experience serious liver problems.
That's a common misconception.
Wow.
You know, the progression of alcohol-associated liver disease varies widely from person to person. Genetics, overall health, other lifestyle factors all play a role in how the liver responds to alcohol.
So it's really not just about the amount you drink. It's also about individual susceptibility to liver damage.
Absolutely. It's a complex interplay of factors, and that's why it's so important to talk to your doctor about your alcohol consumption and any potential risks.
Good advice. This has been a really sobering discussion about the impact of alcohol on the liver. Now, I'd like to circle back to cirrhosis for a moment. We've touched on it as a potential outcome of chronic hepatitis and alcohol abuse, but can you elaborate on, how it develops and what makes it so serious?
Sure. So cirrhosis is essentially the end stage of chronic liver damage, regardless of the cause.
Okay.
It's a battlefield where healthy liver tissue has been replaced by scar tissue, disrupting blood flow and impairing the liver's ability to function properly.
Oh, it sounds like a losing battle for the liver.
It can be. And what makes it so dangerous is that it can lead to a whole host of complications. As the liver struggles, you might see jaundice, ascites, and the development of esophageal varices.
Okay, so let's break those down for a second. Jaundice, we know that's the yellowing of the skin
Mhm.
due to the bilirubin buildup. But what are ascites and esophageal varices?
So ascites is the buildup of fluid in the abdomen, often caused by portal hypertension.
Okay, portal hypertension. That sounds intense. What exactly is that?
So imagine the portal vein, which carries blood from the digestive organs to the liver, like a highway.
Okay.
When cirrhosis causes scarring and blocks that blood flow, it creates a traffic jam, leading to increased pressure in the portal vein.
Oh,
And that pressure can force fluid to leak out of the blood vessels and into the abdominal cavity, causing ascites.
so it's like a backup in the system,
Yeah,
and it has nowhere to go
right.
but to go into the abdomen.
Exactly.
Wow. And then this increased pressure, it can also lead to esophageal varices.
That's right.
What are those?
So varices are essentially enlarged veins in the esophagus. They're like weakened, bulging blood vessels that are prone to rupture and bleed.
And I'm seeing here that bleeding esophageal varices can be a life-threatening medical emergency.
Absolutely.
Oh, wow. And to make matters worse, cirrhosis can also lead to hepatic encephalopathy.
That's right.
Encephalopathy, that sounds like it's affecting the brain.
It does. Remember how we talked about the liver's role in detoxification? Well, when the liver's severely damaged, it can't filter toxins effectively. Those toxins, like ammonia, can build up in the blood and reach the brain, causing a range of neurological problems.
So it's like the brain is being poisoned by toxins that the liver can no longer handle.
Exactly. Hepatic encephalopathy can manifest as confusion, disorientation, personality changes, and even coma.
It's amazing how, like, all these systems are so interconnected. A problem in one organ can have cascading effects throughout the body.
Absolutely. It highlights the importance of a holistic view of health.
Absolutely. Now, before we move on to the other GI organs, I'd like to touch upon a common but often misunderstood condition. Cholelithiasis.
Okay.
Cholelithiasis. That's the medical term for gallstones, right?
That's right.
We've mentioned them a few times already, but I'd love to do a deep dive on what they are and why they cause so much trouble.
So gallstones are hardened deposits that form in the gallbladder, most commonly made up of cholesterol. Think of them as like little pebbles that can disrupt the flow of bile,
Oh, okay.
leading to a range of problems.
Right. And we've talked about, gallstones blocking the bile duct, causing cholecystitis, but I'm curious what causes them to form in the first place.
It's often a combination of factors. When bile becomes oversaturated with cholesterol, it can start to crystallize, forming tiny stones.
Ew.
Over time, these stones can clump together and grow larger.
And there's a handy mnemonic for remembering the risk factors, the 4Fs: female, fat, 40, and fertile.
You got it.
So it's a combination of hormonal and lifestyle factors that contribute to the risk.
Absolutely.
And while many people with gallstones don't experience any symptoms, the trouble starts when those stones block the flow of bile.
Exactly.
And that can lead to cholecystitis, that pain and inflammation that we talked about earlier.
Right.
And a gallstone blocking the opening where the pancreatic duct joins the common bile duct can even trigger pancreatitis. It's like a domino effect. A gallstone can wreak havoc in multiple organs.
It can. And speaking of pancreatitis, that's our next stop on this deep dive. Let's delve into what happens when this powerful gland becomes inflamed.
Okay, pancreatitis. We often hear about it being linked to heavy alcohol consumption.
Absolutely. Alcohol is a major risk factor. But pancreatitis can also be triggered by gallstones, high levels of triglycerides, certain medications, infections, and even trauma to the abdomen.
So a wide range of potential triggers, but what exactly happens during pancreatitis? Like, how does that inflammation develop?
So it's actually quite fascinating, though not in a good way. The pancreas produces these powerful digestive enzymes, but normally those enzymes are inactive until they reach the small intestine.
Right.
In pancreatitis, for various reasons, those enzymes become activated prematurely inside the pancreas itself.
Oh, no. So instead of breaking down food in the small intestine, they start attacking the pancreas.
Exactly, and that self-digestion is what causes that hallmark symptom of pancreatitis, that severe pain in the upper abdomen, often radiating to the back.
Yeah, and the pain can be so intense that even vomiting doesn't provide relief.
It can. It can be excruciating, often accompanied by nausea, vomiting, fever, and a rapid heartbeat. In severe cases, you might even see bruising around the belly button or flanks indicating internal bleeding.
Oh, wow, that sounds terrifying. What can be done to treat pancreatitis?
Well, the first step is usually hospitalization for supportive care, like IV fluids and pain management. Depending on the severity and underlying cause, you might also need antibiotics, surgery, or other procedures.
So we talked about gallstones being a potential cause of pancreatitis. If that's the case, would you automatically remove the gallbladder?
Often, yes. Removing the gallbladder can prevent future gallstone attacks and significantly reduce the risk of recurrent pancreatitis. It's a proactive approach to protecting the pancreas from further damage.
It seems like pancreatitis is a complex condition that requires careful medical management. Um, Now, before we move on, I'd like to touch upon the different types of pancreatitis. I know we've been talking about acute pancreatitis,
Right.
but there's also a chronic form of the disease, right?
That's right. So while acute pancreatitis is a sudden, often severe attack, chronic pancreatitis is a long-term battle.
So the inflammation never really goes away.
Exactly. With chronic pancreatitis, that inflammation persists, leading to scarring and permanent damage to the pancreas. Over time, this damage can impair its ability to produce both digestive enzymes and hormones.
So it affects both the exocrine and endocrine functions of the pancreas.
Precisely, and this can lead to a whole range of problems, from difficulty digesting food and absorbing nutrients to impaired blood sugar control and even the development of diabetes.
Wow. So chronic pancreatitis can have widespread effects on the body.
Yeah.
What are the main differences in how acute and chronic pancreatitis present?
So, with acute pancreatitis, the pain is often sudden, sharp, and severe, requiring immediate medical attention. Chronic pancreatitis, on the other hand, tends to develop more gradually. The pain might be less intense but more persistent, a constant ache rather than a sudden stabbing sensation.
And I'm also seeing here that people with chronic pancreatitis may experience weight loss, diarrhea, and oily stools due to the pancreas's inability to produce enough digestive enzymes.
You're absolutely right. And that damage to the pancreas can also impair its ability to produce insulin, leading to high blood sugar levels and an increased risk of developing diabetes.
So it sounds like chronic pancreatitis is a real challenge to manage both for patients and healthcare providers.
It can be, and unfortunately, the damage is often irreversible, so prevention is key.
So what can people do to protect their pancreas and lower the risk of developing pancreatitis?
Well, limiting alcohol consumption is crucial.
Yeah.
We've seen how alcohol can wreak havoc on the liver, and it's just as damaging to the pancreas. Maintaining a healthy weight, managing other risk factors like high triglycerides, and being mindful of medications that can contribute to pancreatitis are also important steps.
This has been an incredibly informative discussion about pancreatitis, and it brings us to another important topic, alcohol use disorder, or AUD. Given its role in both acute and chronic pancreatitis, I think it's essential to address this issue head on.
I agree.
So AUD is a serious condition that affects millions of people and contributes to a wide range of health problems. Pancreatitis, liver disease, heart disease, even certain types of cancer. So let's break down what AUD actually is. How is it defined?
AUD is characterized by an inability to control alcohol consumption despite negative consequences. It's not just enjoying a drink now and then, it's a pattern of drinking that interferes with your life, whether it's affecting your relationships, your work, your health, or your finances.
So even if someone recognizes that they have a problem and tries to quit or cut back, they still find it incredibly difficult to do so.
Exactly. AUD is not simply a lack of willpower, it's a complex condition with biological, psychological, and social components. There's a physical dependence on alcohol, and often underlying emotional issues or mental health conditions that contribute to the problem.
And I'm seeing here that AUD is diagnosed based on specific criteria outlined in the Diagnostic and Statistical Manual of Mental Disorders, or DSM-5.
That's right. The DSM-5 provides a framework for diagnosing mental health disorders, and AUD is included as a substance use disorder.
Can you give us a few examples of the criteria used to diagnose AUD?
Of course. Some of the key indicators include a persistent desire or unsuccessful efforts to cut down or control alcohol use, spending a significant amount of time obtaining, using, or recovering from the effects of alcohol, craving alcohol, and continuing to drink despite having recurrent physical or psychological problems that are likely caused or worsened by alcohol.
It sounds like a vicious cycle. The drinking causes problems, but the person continues to drink, which only makes the problems worse.
It is a very common pattern with AUD. Another hallmark of the disorder is withdrawal symptoms when alcohol consumption is stopped or reduced.
Withdrawal symptoms. What are those and why are they so concerning?
So when someone with AUD suddenly stops or significantly reduces their alcohol intake, their body can react in a number of ways.
Okay.
It's like the body is rebelling against the absence of alcohol. These withdrawal symptoms can range from mild to severe.
So what kinds of symptoms might someone experience during alcohol withdrawal?
So the symptoms can vary depending on the severity of the AUD, but some common symptoms include anxiety, tremors, sweating, nausea, vomiting, insomnia, and increased heart rate. In more severe cases, alcohol withdrawal can lead to seizures, hallucinations, and a dangerous condition called delirium tremens, or DTs.
BTs, I've heard that term before, but what exactly is it?
DTs are a severe and potentially life-threatening form of alcohol withdrawal.
Oh, wow.
It's characterized by confusion, agitation, fever, a rapid heartbeat, and sometimes even seizures and hallucinations.
Wow, that sounds incredibly dangerous.
It is. If someone's experiencing severe alcohol withdrawal symptoms, including DTs, it's critical to seek immediate medical attention.
So it's a medical emergency.
It can be, yes. DTs can be fatal if not treated promptly. Medical professionals can provide medications and supportive care to help manage those withdrawal symptoms safely and effectively.
So I'm seeing here that there's a specific protocol for assessing and managing alcohol withdrawal called the CIWA protocol. What is that?
CIWA stands for Clinical Institute Withdrawal Assessment for Alcohol. It's a standardized tool used to assess the severity of withdrawal symptoms and guide treatment decisions.
So it helps healthcare providers determine the level of care someone might need based on how severe those withdrawal symptoms are.
Exactly. The CIWA protocol involves regular assessments of vital signs like heart rate, blood pressure, temperature, as well as a rating of specific withdrawal symptoms such as tremors, anxiety, and hallucinations.
And based on the score, medical professionals can then determine whether medications are needed to help manage the withdrawal safely.
Exactly. Benzodiazepines, a class of medications that have calming effects, are often used to help reduce anxiety, tremors, and other withdrawal symptoms and prevent more serious complications like seizures and DTs.
So the CIWA protocol is really a critical tool for managing alcohol withdrawal safely and effectively.
Absolutely. It helps ensure that people experiencing alcohol withdrawal receive appropriate care and support during a very vulnerable time.
This has been a very heavy but incredibly important discussion about alcohol use disorder and its impact on the body. AUD is a serious condition, but it's important to remember that help is available. If you or someone you know is struggling with alcohol abuse, please reach out for help. There are effective treatments available. Counseling, support groups, medications that can help people overcome AUD and reclaim their health and well-being.
I couldn't agree more. Recovery is possible. Seeking help is the first step.
It is. All right, so we've explored the liver.
Yes.
We've talked about the pancreas. We've hit on the gallbladder and its little troublemaker, the gallstones. Now I think it's time to move on to some other key players in the GI system.
All right.
The stomach and intestines.
Let's do it.
Let's dive in.
Okay. It's encouraging to know that there's help out there. But shifting gears a bit, I'd like to revisit a topic that we touched upon earlier, cholelithiasis or gallstones.
Yeah, let's dive back into that. We've talked about gallstones blocking the bile duct and causing all sorts of trouble. But I'm curious about the diagnosis and treatment aspects. Like, what are some of the red flags that might signal gallstone problems, and how are they typically managed?
Well, the most common symptom is pain, often in the upper right abdomen after eating fatty foods.
Oh,
Think of it as the gallbladder trying to squeeze that bile through a blocked duct. Not a pleasant experience. And the pain can be sudden and intense, sometimes radiating to the back or shoulder blade.
so that's why people with gallstone issues often have pain after a greasy meal. It all makes sense now. Are there any other warning signs to look out for?
There can be. Nausea, vomiting, indigestion, bloating, and even jaundice can occur, especially if that blockage is severe enough to back up bile into the bloodstream.
And jaundice is, a pretty clear sign that something's amiss.
It is.
It's interesting how a problem in the gallbladder can manifest in such a visible way.
Yeah, it really highlights how interconnected these systems are. Now, if someone is experiencing these symptoms, it's crucial to see a doctor promptly. Early diagnosis and treatment are key to preventing complications and preserving gallbladder function.
Okay, so let's say gallstones are confirmed. What are the treatment options? I know we briefly discussed surgery.
Right, so the most common treatment is surgery to remove the gallbladder, known as a cholecystectomy.
Okay.
It's a relatively safe and effective procedure, and most people recover quickly.
And you can live a perfectly normal life without a gallbladder.
You can. The gallbladder is helpful, but it's not essential for survival.
Okay.
Your liver will still produce bile. It just flows directly into the small intestine without being stored and concentrated in the gallbladder.
That's good to know. Now, are there any non-surgical options, for patients who might not be good candidates for surgery?
There are. In some cases, medications can be used to dissolve the gallstones, though this is a slow process and not always successful.
Okay.
Another option is shockwave therapy, which uses sound waves to break up those gallstones into smaller pieces that can pass through the bile duct.
It's amazing how technology can offer these less invasive treatment options.
It is.
It seems like there's a whole toolbox of approaches to managing gallstones these days.
There is. And the best approach depends on individual factors and the severity of the condition. It's always important to discuss the risks and benefits of each option with your doctor to determine the most appropriate course of action.
That makes sense. Okay, I'd like to shift gears now and explore how GI conditions are diagnosed in general. We've talked about symptoms, but what tests are used to actually confirm a diagnosis and guide treatment decisions?
Well, it often involves a multifaceted approach. It starts with a thorough medical history and physical exam. Your doctor will want to know about your symptoms, their duration, any medications you're taking, any family history of GI problems.
So it's like detective work gathering clues.
Exactly. And during the physical exam, your doctor will likely examine your abdomen, checking for tenderness, swelling, or any other abnormalities.
And then depending on the findings, they might order blood tests.
Exactly. Blood tests can reveal a wealth of information about liver function, pancreatic function, and inflammation levels. For instance, elevated liver enzymes like AST and ALT can suggest liver damage, while elevated amylase and lipase levels might indicate pancreatitis.
It's like the blood holds valuable clues about what's happening.
It really does. And blood tests can also help rule out other conditions that might be mimicking GI symptoms.
Right. In addition to blood work, are imaging scans frequently used to visualize the organs and look for any structural abnormalities?
Absolutely. Things like ultrasound, CT scan, MRI, they all play a role. An ultrasound might show gallstones. A CT scan could reveal a pancreatic tumor. An MRI can provide even more detailed images of soft tissues.
It's remarkable how imaging technology allows us to actually see inside the body.
It is.
And pinpoint those problems.
Yeah.
Now, in some cases, might more specialized aging tests be needed, like an ERCP?
They might. So ERCP, or endoscopic retrograde cholangiopancreatography, uses a long, flexible tube with a camera on the end to visualize the bile ducts and pancreatic duct.
Right. Remember, you mentioned it can also be used for treatment,
It can.
like removing gallstones or placing stents.
Exactly. So it's a versatile tool for both diagnosis and treatment.
Wow, that's impressive.
Yeah.
Now, sometimes a biopsy might be necessary to examine a small tissue sample under a microscope.
It might.
So if a doctor suspects a tumor or another concerning abnormality,
Right.
a biopsy can help confirm that diagnosis.
Absolutely.
It seems like there's really a whole arsenal of diagnostic tools available to pinpoint GI issues.
There is. And in some cases, even after all these tests, the diagnosis might still be unclear. It's important to remember that medicine is not always black and white, and sometimes it takes time and careful observation to arrive at the right diagnosis.
That's a good reminder that healthcare is a process, and sometimes the answers don't come easily. Now, I'd like to shift our focus from the liver, gallbladder, and pancreas to another critical part of the GIA, tract the stomach and intestines.
Okay.
So the stomach and intestines, this is where the real action of digestion and absorption takes place.
Mm-hmm.
The stomach with its muscular walls and acidic environment acts as a powerful churning chamber, breaking down food into a mixture called chyme.
It does.
It's amazing how our bodies can handle such a harsh acidic environment.
It is. The stomach lining has a special protective layer that prevents that acid from damaging the stomach itself.
Like a built-in shield.
Exactly.
Now, I'm also seeing here that the stomach plays a crucial role in regulating the flow of food into the small intestine.
That's right. At the bottom of the stomach is the pyloric sphincter.
Okay.
It's a muscular valve that acts like a gatekeeper, controlling the release of that chyme into the duodenum, the first part of the small intestine.
So it prevents the small intestine from being overwhelmed with too much chyme at once.
Exactly.
It's like a traffic controller, ensuring a smooth flow of food through the system.
Exactly.
Now, once that chyme enters the small intestine, that's where the real magic of digestion and absorption kicks in. The small intestine is where most of the nutrients from our food are absorbed into the bloodstream.
That's right.
But I always found it fascinating how such a long organ actually fits into our abdomen.
It's a great question, and it highlights the incredible efficiency of the human body. The small intestine, despite its length, is remarkably compact thanks to its intricate folds and finger-like projections called villi.
Villi, those sound familiar.
Yeah.
I vaguely remember learning about them in biology class.
Think of the villi as tiny finger-like extensions that increase the surface area of the small intestine. This increased surface area is crucial for maximizing nutrient absorption. In fact, the surface area of the small intestine is estimated to be equivalent to a tennis court.
Wow, that is incredible. I had no idea it had that much surface area.
Yeah.
So as that chyme travels through this vast landscape, it's constantly being broken down further, and those nutrients are being absorbed into the bloodstream.
That's exactly right. And to aid in this process, the small intestine receives bile from the liver and gallbladder to help digest fats, as well as digestive enzymes from the pancreas to break down those proteins and carbohydrates.
It's like a perfectly orchestrated symphony of organs
It is.
working together to extract the nutrients that we need. Now, any disruption to this delicate balance can lead to digestive issues,
Absolutely.
some of which are surprisingly common.
Very much so.
And that leads us perfectly into the next part of our discussion, common conditions that affect the stomach and intestines. Now, I know we could spend hours talking about all of them, but what are some of the key conditions that often come up in clinical practice?
Well, one that very frequently affects people is gastroesophageal reflux disease, or GERD. You might know it as heartburn or acid reflux.
GERD. Oh, yeah, I've definitely heard that.
Yeah.
It seems like everyone knows someone who suffers from heartburn. What causes it?
So GERD occurs when that stomach acid flows back up into the esophagus, causing that burning sensation we know as heartburn.
Right.
It all comes down to a little valve called the lower esophageal sphincter, or LES.
The LES. Okay, what's its role in all of this?
So the LES acts like a one-way door between the esophagus and the stomach.
Okay.
It allows food to pass into the stomach, but it's supposed to prevent stomach acid from escaping back up into the esophagus.
So in GREA, is the LES malfunctioning?
Precisely. It's either weak or relaxes inappropriately, allowing that stomach acid to flow back up into the esophagus, leading to irritation and inflammation.
I'm curious what causes the LES to malfunction like that. I've always wondered if, like, stress plays a role.
That's a common belief. And while stress can certainly exacerbate GERD symptoms, it's not usually the primary cause.
Okay.
Often certain foods, like fatty or spicy meals, caffeine, alcohol, and smoking, are the culprit.
The lifestyle factors can definitely contribute
Absolutely.
to GERD.
Yes. Other risk factors include obesity, pregnancy, and certain medications.
And I'm seeing here that a hiatal hernia can also increase the risk of GERD.
That's right.
What is a hiatal hernia, and how does that relate to the LES?
So a hiatal hernia occurs when part of the stomach pushes up through the diaphragm, the muscle that separates the chest from the abdomen. It's as if the stomach is bulging up into the chest cavity.
Oh, wow.
And this can weaken the LES, making it more prone to allowing that acid reflux.
Okay, that makes sense. So if someone's experiencing frequent heartburn or acid reflux, it's important to see a doctor.
Absolutely.
Right.
GERD can usually be managed with lifestyle modifications and medications.
Okay, so what kind of lifestyle changes can help?
Well, simple things like avoiding trigger foods, losing weight if needed, and quitting smoking can make a big difference. And medications such as antacids and proton pump inhibitors can help neutralize that stomach acid and reduce the irritation in the esophagus.
So it's often a multi-pronged approach, combining lifestyle changes with the medical interventions.
Exactly. And in some cases, surgery might be an option to strengthen the LES and prevent that reflux.
That's good to know. Okay, moving on from GERD, what about peptic ulcer disease?
Okay.
Those ulcers in the stomach or duodenum, they can be incredibly painful.
It certainly can be. For years, stress and spicy foods were considered the main culprits behind peptic ulcers. But now we know that the majority of ulcers are actually caused by a bacterial infection.
A bacterial infection? That's interesting. I remember hearing that, like, stress was the main cause.
It was a common belief for a long time.
So which bacteria is responsible for these ulcers?
It's called Helicobacter pylori, or H. pylori for short.
H. pylori. I've heard of that. It can live in the stomach, right?
Yeah.
But if it's so common, why don't more people develop ulcers?
That's a great question. And it highlights the complex interplay between bacteria and the human body. While about half the world's population is infected with H. pylori, most people never experience any symptoms.
Oh, wow.
However, for some, the bacteria trigger an inflammatory response that damages that protective lining of the stomach, or duodenum, leading to ulcer formation.
So it's not just about the presence of the bacteria, but how the body reacts to it.
Exactly. And the resulting ulcers can cause pain, bleeding, and even perforation if left untreated.
Perforation, that sounds serious.
It is. Perforation means the ulcer has eroded all the way through the stomach or duodenal wall, allowing digestive juices to leak into the abdominal cavity.
Oh, wow.
This can lead to peritonitis, a life-threatening infection of the abdominal lining.
So those ulcers are definitely not something to take lightly.
They're not.
What are the symptoms of a perforated ulcer?
Severe abdominal pain is the most prominent symptom, especially if it comes on suddenly and is accompanied by fever, nausea, vomiting, or a rigid abdomen.
Got it.
It's crucial to seek immediate medical attention if you experience those symptoms.
Okay, noted. Now, how are peptic ulcers diagnosed and treated? I imagine it involves testing for that H. pylori bacteria.
It does. Diagnosis often involves a combination of tests. Blood tests to check for H. pylori antibodies.
So those antibodies are the proteins produced by the immune system in response to an infection. So if you have antibodies to H. pylori, it means you've been infected with the bacteria at some point.
That's right. Another common test is a breath test to detect the presence of H. pylori.
A breath test for a stomach bacteria. That's fascinating. How does that work?
You swallow a special solution containing a substance that H. pylori breaks down. If the bacteria are present in your stomach, they'll release carbon dioxide, which you then exhale. The breath test measures the amount of carbon dioxide in your breath, indicating whether or not you have an active H. pylori infection.
That's incredibly clever. Science never ceases to amaze me. Now, if H. pylori is confirmed, what's the treatment?
Treatment typically involves a combination of antibiotics to eradicate the bacteria and medications to reduce stomach acid and promote healing of the ulcers.
So it's a multi-pronged approach to tackle both the infection and the damage that it's caused.
Exactly. And lifestyle modifications such as avoiding alcohol and non-steroidal anti-inflammatory drugs or NSAIDs can also help prevent ulcer formation and recurrence.
So those NSAIDs are common pain relievers like ibuprofen and naproxen.
They are. While they're very effective for pain relief, they can irritate the stomach lining and increase the risk of ulcers, especially if taken frequently or in high doses.
So it's important to talk to your doctor about the risks and benefits of any medications you're taking, even over-the-counter ones.
Absolutely. And remember, if you're experiencing any persistent stomach pain or other digestive symptoms, don't hesitate to seek medical attention.
Good advice. Okay, we've covered GERD and peptic ulcers, both of which can cause significant discomfort. What about inflammatory bowel disease or IBD? I know it's a broad term, but can you explain what it encompasses?
So IBD is an umbrella term for a group of disorders that cause chronic inflammation of the digestive tract.
Okay.
The two most common types of IBD are Crohn's disease and ulcerative colitis.
Ah, I've heard of those. I know they both involve inflammation, but how do they differ? I'm always a little bit fuzzy in the details.
So the key difference lies in where that inflammation occurs and how it affects the digestive tract. Crohn's disease can affect any part of the digestive tract from the mouth to the anus, but it most commonly affects the small intestine and the beginning of the large intestine.
Okay.
The inflammation in Crohn's disease is often patchy, meaning it affects some areas while sparing others.
So it's like having little islands of inflammation
Exactly.
scattered throughout the digestive tract.
That's a great way to visualize it. And the inflammation in Crohn's disease often extends deep into the layers of the intestinal wall, which can lead to complications like strictures and fistulas.
Strictures and fistulas, what are those?
So strictures are narrowed areas of the intestine caused by scarring and inflammation. They can obstruct the flow of food. And fistulas are abnormal connections that can form between different parts of the intestine or between the intestine and other organs, leading to infections and other problems.
Wow, so Crohn's disease can really disrupt the normal structure and function of the digestive tract.
It can.
What about ulcerative colitis? How does that differ?
Ulcerative colitis is limited to the colon, also known as the large intestine.
Okay.
Unlike the patchy inflammation of Crohn's disease, the inflammation in ulcerative colitis is continuous, affecting the entire lining of the colon. It typically starts in the rectum and extends upward.
So it's more widespread inflammation in the colon,
Yes.
but it doesn't extend beyond the colon like Crohn's disease can.
Yes. Exactly. And while ulcerative colitis is generally less likely to cause those strictures and fistulas, it can still lead to complications like severe bleeding and a higher risk of colon cancer.
Oh, wow. It sounds like both Crohn's disease and ulcerative colitis can cause significant digestive distress.
It can.
What are some of the common symptoms?
So both conditions can cause abdominal pain, diarrhea, rectal bleeding, weight loss, and fatigue. The severity and frequency of symptoms can vary greatly from person to person and can even change over time.
And IBD can also lead to complications outside of the digestive tract, right? Like joint pain, skin rashes, and eye inflammation.
Absolutely. IBD is considered a systemic disease, meaning it can affect multiple organs throughout the body.
Oh, wow.
This is thought to be due to that overactive immune response that drives inflammation in the digestive tract, which can spill over and affect other systems.
It's fascinating, though, not in a good way. It really underscores the complexity of IBD and the challenges that it can present. Now, I know there's no cure for IBD, but what treatment options are available to manage symptoms and prevent complications?
Well, treatment often involves a combination of medications tailored to the individual's needs and disease severity. Anti-inflammatory drugs, immunosuppressants, and biologics are often used to reduce that inflammation and control symptoms.
And biologics, those are medications that target specific proteins involved in the inflammatory process, right?
They are. Biologics can be very effective at reducing inflammation and controlling IBD symptoms, but they can also have side effects.
Right.
So careful monitoring is essential.
In addition to medications, do lifestyle modifications play a role in managing IBD?
They absolutely do. Eating a healthy diet, managing stress, getting enough rest, and avoiding trigger foods can all contribute to better symptom control and improved quality of life.
Okay, so it's really about finding that right combination of treatments and lifestyle adjustments that work best for each individual.
Exactly. And in some cases, surgery might be necessary to remove damaged sections of the intestine or to create a new opening for waste to exit the body, especially if medications and lifestyle changes aren't providing adequate relief or if complications arise.
So it sounds like managing IBD is a lifelong journey that requires a strong partnership between patients and their healthcare providers.
It really is. It's a chronic condition that can present some unique challenges. But with the right approach, people with IBD can live full and active lives.
We've covered a wide range of GI conditions today: GE dirty, peptic ulcers, Crohn's disease, and ulcerative colitis. And it's clear that the digestive system is remarkably complex and vulnerable to a variety of disorders.
It is. But as we've discussed, we're learning more and more about these conditions every day, and there are effective treatments and management strategies available.
Absolutely. And it's crucial to remember that early detection and intervention can make a world of difference in preventing those complications and improving long-term outcomes. So if you're experiencing any concerning or persistent digestive symptoms, don't hesitate to seek medical attention.
I couldn't agree more. Now, before we wrap up this part of our deep dive, I'd like to revisit the pancreas for a moment.
Okay.
We talk extensively about pancreatitis, but I'd like to touch upon another important aspect of pancreatic function, its role in hormonal regulation, specifically insulin production.
Yes, let's talk about insulin. I know it's a critical hormone for regulating blood sugar. Can you remind us where it's produced and what it does?
Sure. So insulin is produced by beta cells within those islets of Langerhans in the pancreas.
Okay.
Think of insulin as a key that unlocks the doors of your cells, allowing glucose or sugar to enter from the bloodstream.
So when we eat, our blood sugar rises, and insulin is released to help our cells take up that glucose for energy.
Exactly. Insulin helps keep those blood sugar levels within a healthy range. When insulin is lacking or not working properly, blood sugar levels can rise too high, a condition known as hyperglycemia.
Right. And I remember you mentioned that the pancreas also produces glucagon.
That's right.
Which has the opposite effect of insulin.
Exactly. Glucagon is like insulin's counterpart.
Okay.
It's released when blood sugar levels drop too low, signaling the liver to release stored glucose back into the bloodstream, helping to raise blood sugar back to a healthy level. Together, insulin and glucagon work in a delicate balance to keep blood sugar stable.
It's amazing how these two hormones, working in opposition, maintain such tight control over blood sugar.
It's a remarkable system, but like any finely tuned system, it can be disrupted.
Which leads us perfectly into the next part of our deep dive, diabetes. Now, I know it's a complex condition with far-reaching implications, but can you give us a brief overview?
Diabetes is a chronic metabolic disorder characterized by elevated blood sugar levels, either due to the pancreas not producing enough insulin or the body cells not responding properly to insulin.
So there are different types of diabetes.
There are. The two main types are type 1 and type 2 diabetes.
Okay.
Type 1 diabetes, often diagnosed in childhood or adolescence, is an autoimmune disorder where the body's immune system mistakenly attacks and destroys the insulin-producing beta cells in the pancreas.
So in type 1 diabetes, the pancreas can't produce enough insulin, leading to those chronically elevated blood sugar levels.
Precisely. People with type 1 diabetes require lifelong insulin therapy to manage those blood sugar levels.
And what about type 2 diabetes? How does that differ?
So type 2 diabetes, the most common type, usually develops gradually over time, often associated with lifestyle factors like obesity, physical inactivity, and poor diet. In type 2 diabetes, the pancreas may still produce some insulin, but the body's cells become resistant to its effects,
Okay.
meaning they don't respond to insulin as efficiently.
So in type 2 diabetes, it's more about the body's inability to use insulin effectively rather than a complete lack of insulin production.
Exactly. And as type 2 diabetes progresses, the pancreas may also start producing less insulin, further compounding the problem.
So it sounds like both types of diabetes, while distinct in their underlying causes, ultimately lead to the same problem: high blood sugar.
That's right.
What are the consequences of these chronically elevated blood sugar levels? I know it can't be good for the body.
You're absolutely right. Chronically elevated blood sugar can damage blood vessels and nerves throughout the body, leading to a wide range of complications.
Such as?
Diabetes can increase the risk of heart disease, stroke, kidney disease, nerve damage, including blindness, and even amputations.
Oh, wow.
It's a serious condition that requires careful management to minimize that risk of complications.
This is all incredibly valuable information. It really highlights the importance of understanding diabetes and its potential impact on overall health.
It does. And speaking of overall health, I'd like to shift our focus now to a group of conditions that can affect the intestines: irritable bowel syndrome, or IBS, and inflammatory bowel disease, or IBD.
Okay, IBS and IBD. I've heard of these conditions, but I often get them confused. Could you clarify the differences?
I can. So while both IBS and IBD can cause abdominal pain and discomfort, they are fundamentally different conditions. IBS is what we call a functional disorder, meaning there's no visible damage or inflammation in the digestive tract. It's more about a disruption in the way that the gut muscles contract and move food through the digestive system.
So in IBS, it's like the communication signals between the brain and the gut are misfiring, leading to those symptoms like abdominal pain, bloating, diarrhea, and constipation.
That's a great way to put it. The exact cause of IBS is still unknown, but it's thought to involve a combination of factors: genetics, gut motility issues, sensitivity to certain foods, and even psychological stress.
So it sounds like IBS is more of a mystery than IBD, with no clear-cut cause or diagnostic markers.
Yeah.
What about IBD? How does that differ?
So IBD, which includes Crohn's disease and ulcerative colitis, as we discussed earlier, is characterized by chronic inflammation in the digestive tract.
Right.
Unlike IBS, where there's no visible damage, IBD involves actual inflammation and damage to the intestinal lining, which can be seen during colonoscopies or biopsies.
So in IBD, there's a clear physical abnormality inflammation, whereas in IBS, it's more about those functional disruptions in the way the gut works.
Exactly.
It's interesting how two conditions with such similar symptoms can have such different underlying causes.
It really highlights the importance of a thorough evaluation to determine the correct diagnosis and guide treatment.
Now, since we've already covered Crohn's disease and ulcerative colitis in detail, let's focus on IBS for a moment. What are some common symptoms, and how is it typically managed?
So the hallmark symptoms of IBS are abdominal pain, bloating, and changes in bowel habits, such as diarrhea, constipation, or both. The severity and frequency of symptoms can vary greatly from person to person. Some people experience mild, occasional discomfort, while others have frequent, debilitating symptoms that significantly impact their quality of life.
I could see how IBS could be incredibly frustrating and disruptive,
It is.
especially if you don't know what's causing it. How do doctors actually diagnose IBS if there's no visible inflammation or damage?
So diagnosing IBS can be challenging because it relies primarily on symptom patterns and ruling out other conditions. Doctors often use specific criteria, such as the Rome-4 criteria, which outlines those symptom patterns characteristic of IBS.
So it's more about recognizing a pattern of symptoms rather than relying on specific tests?
Exactly. Doctors may also order tests to rule out other conditions, such as celiac disease, inflammatory bowel disease, or infections.
So it's like eliminating the other suspects before you arrive at the most likely culprit.
Precisely. And once other conditions have been ruled out and the diagnosis of IBS is established, the focus shifts to managing those symptoms and improving quality of life.
So what kinds of treatments are available for IBS?
There's no one-size-fits-all approach to treating IBS, but management often involves a combination of lifestyle modifications, dietary changes, and medications.
Can you elaborate on those approaches a bit?
Sure. So lifestyle modifications might include stress management techniques, regular exercise, and getting enough sleep. Dietary changes often involve identifying and avoiding trigger foods, such as certain types of carbohydrates, fatty foods, caffeine, and alcohol.
So it's about paying attention to your body and how it responds to different foods and situations.
Exactly. Keeping a food journal can be very helpful in identifying those trigger foods and patterns.
What about medications? What types of medications are used to manage those IBS symptoms?
So the choice of medication depends on the predominant symptoms.
Okay.
For example, antidiarrheal medications might be used for diarrhea-predominant IBS, while laxatives might be helpful for constipation-predominant IBS. Other medications, such as antispasmodics or antidepressants, might be used to reduce that abdominal pain and discomfort.
It seems like managing IBS is a very individualized process,
It is.
involving a combination of strategies tailored to each person's specific needs and symptoms.
Absolutely. It often requires patience and persistence, working closely with your healthcare provider to find the best approach.
Well, we've covered a lot of ground in this deep dive. We've explored the complexities of the liver, gallbladder, and pancreas, delved into conditions like GERD, peptic ulcers, IBD, and IBS, and even touched upon diabetes.
We have, and it's been a fascinating journey, highlighting the intricate workings of the digestive system and its crucial role in overall health.
Before we wrap up this second part, I'd like to shift gears slightly and explore another aspect of digestive health that's often overlooked: the gut microbiome.
Ah, yes, the gut microbiome.
A fascinating and rapidly evolving area of research.
It is.
I've heard so much about the gut microbiome in recent years, but I'm still a bit fuzzy on the details. Can you give us a crash course?
Think of the gut microbiome as a vast, complex ecosystem residing within your digestive tract. It's a community of trillions of microorganisms, bacteria, fungi, viruses, and other microbes that play a crucial role in your health.
Trillions of microorganisms living inside us. That's both amazing and a bit unsettling.
It is. But don't worry, most of these microbes are beneficial and essential for our well-being.
Okay, that makes me feel a little bit better. So what exactly are all of these gut microbes doing down there?
They perform a wide range of functions, some of which we're only beginning to understand. They help us digest food and absorb nutrients, playing a crucial role in breaking down those complex carbohydrates and producing certain vitamins like vitamin K and B vitamins. They also interact with our immune system, helping to train it to distinguish between harmless and harmful substances.
So they're like tiny chefs and trainers all rolled into one.
A great analogy. And their influence extends beyond the gut.
Oh,
Research suggests that the gut microbiome can influence our metabolism, affecting how we store fat and regulate blood sugar. There's even emerging evidence suggesting that the gut microbiome can impact our mood, behavior, and cognitive function.
wow. So these tiny organisms have a much bigger impact than I ever imagined. What factors influence the composition of our gut microbiome?
Well, many factors can shape the composition of our gut microbiome: genetics, diet, lifestyle, medications, and even exposure to environmental toxins.
So it's not just about what we inherit from our parents.
Right.
It's also about the choices that we make and the environments that we live in.
Exactly. And what's fascinating is that the gut microbiome is constantly evolving and adapting throughout our lives.
That makes sense. Our bodies are constantly changing, so it stands to reason that our gut microbiome would change as well.
Precisely. And these changes can have both positive and negative implications for our health. Host speaker.
That leads us perfectly into the next part of our discussion, the gut-brain connection. I've heard about this fascinating link between our gut and our brain. But can you shed more light on it?
The gut-brain connection is a bidirectional communication pathway between the digestive system and the central nervous system, including the brain. These two systems are constantly talking to each other, influencing each other's function.
So it's not just a one-way street where the brain controls the gut. The gut can actually send signals back to the brain.
Exactly. It's a two-way highway of communication.
Okay.
And this communication occurs through various mechanisms, including the vagus nerve, a long nerve that connects the gut to the brain, as well as through hormones and neurotransmitters produced in the gut.
It's amazing how interconnected these systems are. I'm starting to see the digestive system in a whole new light.
It's remarkable.
It really is. And the gut-brain connection is an area of intense research with growing evidence suggesting that the gut microbiome plays a key role in this communication pathway.
It does.
So the trillions of microorganisms living in our gut can actually influence our brain function. That's mind-boggling.
It is. Research suggests that gut microbes can produce neurotransmitters like serotonin and dopamine, which play crucial roles in mood regulation, sleep, and even cognitive function.
So the gut microbiome is like a hidden control center, influencing not just our physical health, but also our mental and emotional well-being.
That's a great way to put it. And this understanding has opened up new avenues for exploring how we can modulate the gut microbiome to improve both physical and mental health.
This is all incredibly fascinating. It's like a whole new frontier of medicine is opening up before our eyes.
It really is, and it highlights the interconnectedness of our bodies and the profound impact that the gut microbiome can have on our overall health.
Well, this discussion of the gut microbiome and the gut-brain connection has definitely given me a lot to think about. It seems like we're just beginning to scratch the surface of understanding the complex interplay between these systems.
Absolutely. It's a rapidly evolving field, and we're learning new things every day.
I'm excited to see what the future holds for research in this area. Now, before we move on to other aspects of digestive health, I'd like to touch upon a topic that often comes up in clinical practice: constipation. It's a common problem, but can you explain what causes it and how it's typically managed?
Sure. Constipation is a condition characterized by infrequent bowel movements or difficulty passing stools. It's a very common problem affecting people of all ages, and it can be caused by a variety of factors.
So what are some of the most common causes of constipation?
Well, one of the most common culprits is a low-fiber diet. Fiber is essential for adding bulk to stools and helping them move through the digestive tract smoothly.
So if you're not eating enough fruits, vegetables, and whole grains, you're more likely to experience constipation.
Exactly. Other lifestyle factors that can contribute to constipation include dehydration, lack of physical activity, and certain medications like pain relievers, antidepressants, and antacids.
It seems like constipation is often related to lifestyle choices, but can it also be a symptom of underlying medical conditions?
It can. Constipation can be a symptom of conditions like hypothyroidism, irritable bowel syndrome, Parkinson's disease, multiple sclerosis, and even colon cancer.
So if someone is experiencing persistent or worsening constipation, especially if it's accompanied by other symptoms, it's important to see a doctor to rule out any underlying medical conditions.
Absolutely. Early detection and intervention are key to addressing any potential problems. Now, what about the flip side of constipation diarrhea? It can range from a minor inconvenience to a more serious health concern. What causes diarrhea, and how is it typically managed?
Yeah, diarrhea is definitely not fun.
It's not. It's characterized by loose, watery stools that occur more frequently than usual, and it can be caused by a variety of things: infections, food intolerances, certain medications, inflammatory bowel disease, and even stress and anxiety.
So like constipation, it can have both physical and psychological triggers. What's the main concern with diarrhea, especially if it's, severe or prolonged?
Dehydration. When you have diarrhea, your body loses fluids and electrolytes more rapidly than usual, which can lead to dehydration if those fluids and electrolytes aren't replenished.
That makes sense. So what's the best way to manage diarrhea and prevent that dehydration?
Rehydration is key. Drinking plenty of fluids like water, clear broths, or electrolyte solutions is crucial to replenishing those lost fluids and electrolytes.
Are there any specific foods that are helpful or harmful when you have diarrhea?
The brat diet is often recommended: bananas, rice, applesauce, and toast.
I've heard of that.
It's easy to digest and can help bind those stools. Foods high in fiber and fat should generally be avoided as they can worsen diarrhea.
Okay, bland and binding is the way to go. What about medications? Are there medications that can help with diarrhea?
Over-the-counter anti-diarrheal medications like loperamide, Imodium, or bismuth subsalicylate, Pepto-Bismol, can help slow down bowel movements and reduce the frequency of stools. However, it's important to note that these medications should not be used for diarrhea caused by certain infections, as they can actually prolong the illness.
So it's always best to consult with a doctor if you're experiencing diarrhea, especially if it's severe, persistent, or accompanied by other symptoms like fever or blood in the stools.
Absolutely. It's important to rule out any serious underlying causes. Now, shifting gears a bit, how about we talk about gas and bloating?
Gas. Not the most glamorous topic, but definitely one worth discussing. What causes that excessive gas and bloating, and is there anything that can be done about it?
Well, gas is a normal part of the digestive process. It's produced as bacteria in the gut break down food, particularly carbohydrates. However, excessive gas and bloating can be uncomfortable and embarrassing.
I can imagine. So what causes some people to experience more gas than others?
Well, several factors can contribute: swallowing air while eating or drinking, eating gas-producing foods like beans and cruciferous vegetables, and certain medical conditions like irritable bowel syndrome and lactose intolerance can also play a role.
I'm lactose intolerant, so I definitely know how certain foods can trigger that gas and bloating. Are there any other culprits to be aware of?
Artificial sweeteners like sorbitol and xylitol, often found in sugar-free foods and drinks, are known to cause gas and bloating in some people.
So are there any strategies for reducing gas and bloating?
There are. Several lifestyle modifications and dietary changes can help. Eating slowly and chewing your food thoroughly can reduce air swallowing. Identifying and avoiding those trigger foods can also make a difference. And over-the-counter products like simethicone, Gas X, can help break down gas bubbles and relieve bloating.
So it sounds like managing gas and bloating often involves a bit of trial and error to figure out what works best for each individual.
It does. It's about paying attention to your body and making adjustments as needed.
Well, this deep dive into the GI system has been incredibly informative. We've explored a wide range of topics, from the functions of those individual organs to the complexities of the gut microbiome and that fascinating gut-brain connection. I feel like I have a much deeper understanding of how the digestive system works and all the many factors that can influence its health.
That's wonderful to hear. It's been my pleasure discussing this with you.
And to our listeners, thank you so much for joining us on this deep dive into the GI system. It's been a fascinating journey, and I hope you've gained valuable insights into this amazing and complex system that plays such a vital role in our overall health and well-being. Until next time, happy digesting.
Happy digesting.